Hi there, my name is Dr. Sana Yasir, and I wanted to bring your attention towards something that is causing a lot of upheaval these days. This is about Person Protection Act. Something that I need to make very clear is that this act does not support LGB or their rights, and anybody can misuse any rights. So, disregarding this Person Protection Act, it serves no purpose. In fact, it will take away the rights that these people have. They're already minorities and they're already very suppressed. So the request is that please read the law first and then assume, or not assume, but then understand what is being asked and how it caters to these gender minorities, transgender people and intersex people. I want to bring your attention towards the word gender dysphoria. Gender dysphoria is a concept. It's a condition, a confusion when your body parts don't align or match up to the expected gender, and your experienced gender or the self-perceived gender is different from the gender that is expected by others around you, especially the ones who announced your birth. So this confusion actually is not just confusion, it's a very, very painful state, kind of like a mental torture for some, depending on how high the dysphoria is in intensity. Since 2013, the Diagnostic Statistic Manual, followed by APA, US, uh, since 2013, they have omitted the so-called gender identity disorder, and omitted because it is not a disorder, it doesn't exist. Instead, it is replaced by a term gender dysphoria, which is diagnosable, clinically diagnosable. You can gauge it, and you gauge it not to nullify someone's experience of it, but to help them lower the intensity of dysphoria. Now, earlier in 1950s and 1960s, 1970s, a therapy was introduced by the psychologists and supported by psychiatrists, and it was called conversion therapy. I want to talk a little bit about conversion therapy because it is condemned by United Nations. It is looked down upon by most of the world. What is it? It is an emotional or a physical therapy used to cure or repair a person's gender identity or expression. It was claimed that this could be achieved, but there is no evidence to support this. Instead, medical and mental health experts have rejected conversion therapy practices as they are dangerous and discriminatory. These putting someone through these conversion therapies also leads to depression and anxiety and possible suicidal ideation. And these what do these look like? They can be psychotherapy, talk therapy. They can be it can include medicine, it can include steroid therapies, um, and in extreme cases, surgeries to neutralize people or sterilize them. It can be faith-based therapy too, but since in 2013, the American Psychiatric Association removed gender identity disorder from its diagnostic manual. The conversion therapies are supposed to, the number of conversion therapies are supposed to go down. Um, Therapists who are still doing them, unlicensed therapists or old school therapists who have not upgraded their learnings, they usually use other terms in place of conversion therapy, kind of like disguise them. So be very, very mindful of what you're being put through. There are certain harms that conversion therapy causes. So it can lead to feeling less than or damaged, impacting self esteem. This can take a significant toll on your emotional and physical health. And, you know, 8 times, statistics show that 8 times more likely to report having attempted suicide, people who are put through these therapies, conversion therapies, almost 6 times most likely to report high level of depression, more than 3 times as likely to use illegal drugs, and more than 3 times likely to be at high risk for HIV and STDs. Now, this is not something that we should be putting people through. Uh, Even in US, several states recognize conversion therapy as inhumane, ineffective, harmful, and discriminatory. And I think that globally, around 13 countries have some ban or regulation against licensed medical health experts practicing conversion therapy. So since Pakistan has a Trans Person Protection Act in place, the law is in place. It must be these conversion therapies must be stopped. There is a need to understand what gender dysphoria is by the healthcare providers, and there is a need to understand that dysphoria can be the intensity can be lowered by non-medical as well as medical interventions. Thank you for listening to this, and please share this with anyone and everyone uh, who says that conversion therapy should be done, or who needs to understand gender dysphoria and what a person goes through. Again, I would say that this is not something that LGB go through. This is not a matter of sexual orientation. Being a transgender is not a matter of having a different sexual orientation. It has to do with gender identity, and a person's gender identity is a very personal self-perception. So doctors or a medical board cannot assign someone's gender. They can assign sex, and sex of rearing in children should be assigned, with the help of a medical board. That's fine. Or you can train the parents or counsel the parents to raise gender neutral children till they are able to speak and communicate their gender. Thank you once again. If you have any queries, please do inform me and write down. You can write to me, you can connect with me, and I am on various platforms. So please reach out. I would love to clarify things for you. This is a matter of human rights. And as a healthcare Pakistani Muslim healthcare provider, I have taken an oath not to discriminate. So this is something I passionately do, and I want to raise the correct awareness. Thank you once again.